Good morning, everyone. Thank you all for taking the time to attend our WA Group webinar series. My name is Ron Linneman, a benefits consultant for WA Group. I have David Sleepak also with us today, who I'll introduce in a few slides, a few housekeeping items to begin with. The webinar is scheduled to go about 45 minutes. There will be no question and answer at the end, so please type your questions into the Q&A. All questions will be compiled into a frequently asked question white paper and sent out to you via email. You can also access any past webinars, the replay, and the FAQs on our website, which is walivebig.com. In addition to that, you can access upcoming webinars. The upcoming webinar in a couple weeks is regarding cybersecurity risks in today's work from home environment. So if that is something that is of interest to you, please log into our website to register for that event. With that, this is our WA Group team. In the benefits side of our business, we are a risk management firm. We specialize in all areas of risk. This happens to be our benefits risk department. So if you are more comfortable sending us an email or making a phone call with your questions, feel free to connect with us directly. This slide will also be up at the end of the presentation in case you need to write down any of our contact information. So who is WA? WA Group is a local 100% employee-owned risk management firm. Our job is to work with employers of all sizes to identify business and people-related risks within their organization, and then create a strategy to help address those risks. How we do it is through our process called VAST. VAST starts with identifying your vision, your goals, what you're trying to accomplish. From there, it's creating an assessment and analyzing your needs, identifying the needs, creating a 3 to 5 year strategy to address those needs, and then just as important, working together as a team, both our team and your team, to accomplish that strategy. Today, the past webinar a couple of weeks ago was discussing one of the risks around healthcare purchasing. Today, it's really discussing one of the solutions to the risks. And so it really comes down to what's the problem? What are we trying to address today? Well, for employees, there are too many barriers to accessing healthcare. Employees are not getting care when they need it most. When that happens, it increases stress, it increases anxiety, and it decreases the production of that employee. For employers, that adds to an increased healthcare spend. When you have an increase in spend, you have an increase in premiums, and it's difficult to attract employees and retain employees when costs keep on going up. So today's presentation is really to dive into what can I do? What is one option? What's one solution? What's one strategy that I can implement for my organization to help address all of those issues? We have a poll up here. If you could please answer the poll, give everyone about a minute or so. But we'd like to know what your challenges are as it relates to your health plan. Annual increases in premiums. Is it high claim utilization? Cost of care? How about the accessibility to getting care? Or maybe it's just a lack of a long-term strategy. We have about 45% of you who have voted. I'll give it about 5 more seconds here. 3, 2, 1. Great. Obviously, annual increases in premiums is a huge issue. So what are employers doing to address that? What solutions are you putting in place to curb the trend? Cost of care is a direct reflection of those increases in premiums. So today's presentation is really to address both of those, which is exciting. You know, our strategy starts with understanding what options are out there from an insurance financing risk standpoint, but then also creating strategies to address that. We get into what sort of technology is out there to understand the access to care. How do I navigate the healthcare system to find the right care at the right time, at the right place, at the right cost? Prescription drugs is really the low-hanging fruit, and second opinions has become more popular than ever. But today it's really targeting trying to help the employee find better, getting the employee better access, and then also helping the employee navigate care. So with that, I want to introduce David Sleepback, who is the Executive Vice President of Business Development at ACOS. He leads ACOS employer-focused healthcare solutions. His mission is to play an active role in scaling strategies and solutions that fix our healthcare system. He's a member of the National Association of Health Underwriters and has taken a number of leadership roles in his Phoenix chapter where he's from, and he also currently serves as the past chapter president. With that, Mr. David.
Hey, good morning, Ron. Good morning, everybody, and thank you so much for joining us today. As Ron mentioned, I'm actually located here in Phoenix and based here. ACOS is also based in the Phoenix market, and I'm super excited to talk about leveraging technology and really a huge and timely solution as we're kind of entering into this kind of COVID-19, post-COVID-19 world. So as Ron mentioned, you know, scaling and increasing access to care is fundamental in reducing, you know, healthcare costs and delivering better solutions, better care, and a long-term strategy for the employer groups that we work with. You know, there's a huge shortage of primary care doctors out there today. Chronic conditions continue to increase. Workers' compensation actually has a huge impact on the bottom line. And we're kind of entering this new normal where people are not only very receptive to accessing care from a virtual perspective, it's kind of the gold standard right now, because who really needs to be in an emergency room? Who really wants to be in an urgent care facility, et cetera, et cetera.
Yeah, and we're seeing these numbers and these issues specific to our clientele as well. Could you tell us a little bit about ACOS?
Yeah, so we've been around for about 4.5 years. Interestingly enough, our first solution was geared towards the workers' comp space. We developed an app and a process and a telemedicine platform that delivers the biggest challenge to workers' comp is speed to injury. So think about it. You have a worksite employee, they get hurt. You got about 1 minute till that employee is going to the emergency room. And oftentimes, about 80% of the time, it's totally unnecessary. So we developed a solution that addresses worksite injury. We can actually have an RN piped in via a secure video call in about 15 seconds that can triage and provide first aid. And then the game changer really is bringing in an occupational health physician to become the physician of record. And you'll hear me talk a lot about kind of the entry point to the healthcare system and why it's so important. When you are running a healthcare plan, a workers' comp plan, et cetera, how your employees enter the healthcare system is key. And you'll hear me talk a lot about how we leverage ACOS, our platform, our technology, and frankly, the fact that our name ends with MD to help guide your employees through the healthcare system. Interestingly enough, about 2.5 years ago, we developed a strategic relationship with Albertsons and Safeway grocery stores. And we developed some really cool technology and a solution for walk-in clinics, making healthcare super easy and affordable. Again, what we're trying to do is increase that access to care and those entry points into the healthcare system. In 2019, I actually came on board and was tasked with developing a virtual direct primary care platform. And that's what we're going to talk about today, and how it is just so effective in really achieving the results that your poll. I'm very mindful. I love the poll that came out. But we're going to talk specifically on how we address those challenges with this solution. Some notable clients we have in the portfolio. We work with some very large national retailers. We work with some insurance companies. We work with logistics organizations, shared healthcare type solutions called medical cost shares, et cetera, et cetera.
So there's, I think, a confusion as to, well, is this just telemedicine? Is this just something that comes with my health plan that I already have today? Can you walk us through what the differences are between the traditional telemedicine and what you're talking about today?
Ron, thank you so much. Yeah. When we talk about technology or we talk about telemedicine and care, people instantly focus in on, well, you're just like Teladoc or MeMD or these telemedicine solutions. And I kind of lump those into urgent cares or minute clinics. And the terminology really focuses around episodic care, okay? So I'll make the analogy. There's about 20 some odd people on this call, maybe more. And we're all going to the airport. We're going to take a taxi cab or an Uber. Look, we're never going to see that taxi cab driver or Uber driver again on the way to the airport, right? Just like we're never probably going to see that Teladoc doctor or an urgent care doctor again. It's episodic care. It's a one and done. There's a problem. I have a sinus infection. I get my antibiotic and I move on, right? But there's a problem with that, because there is so much, I like to call doctoring, happening between episodes, between that sinus infection, between that virus, between pink eye, between your UTI, et cetera, right? And those are the things that are so mindful in actually reducing healthcare costs. So what ACOS brings to the table, what direct primary care brings to the table, is a one-to-one relationship, a continuous one-to-one relationship with a primary care provider, and in our case, a healthcare navigator. And here's the key: it's a non-conflicted value-based payment model. So we're going to use the analogy again. We're all going to the airport, but this time we're going to get in my private car with my private driver, and that driver knows everything about me, knows when I'm coming back, knows when my next trip is, knows my wife's name, knows how I like to go to the airport, knows what drink or radio station, and that is how we provide continuity of care in the marketplace. Now, we use technology to remove those barriers, but we are fundamentally providing a continuous relationship with lots of things that happen in the middle. So why value-based primary care? Super important concept here. And you ever notice when you go to the doctor and they say, well, I'm going to order some lab work, and then they send you to a lab, and then they say, well, now I need to come back in to review the lab work. Or have you ever noticed, if you're on a prescription, they won't like refill it over the phone? They're like, yeah, you need to come in. Well, that's because in the fee-for-service world, the only way that a provider can make revenue is to have you come into the office, right? Which makes healthcare really not real convenient, kind of expensive. And ultimately, it works really well for doctors, but it doesn't necessarily work well for their patients. And the problem is they have to cram, especially for primary care physicians, 30, 40, 50 visits a day into their schedule just to break even, just to make any money. So you wait in the waiting room for an hour and a half. They finally put you in a room. You wait in the room for 45 minutes, and then you see the doctor for 5 minutes. You're like, what just happened, right? And they're rushed, and they're just, well, here's your medicine, and get on your way with it. So when we move into what we call a value-based payment methodology, the doctors are paid a monthly membership fee or capitated fee to take care of their patients. And instantly, what happens is those providers are now aligned with the user and purchaser of healthcare. You know who the users and purchasers of healthcare is? Employers, right? And their employees. So when we move to this methodology and payment methodology, doctors can provide all sorts of other services because they're not under the gun to see 50 patients a day. They can engage in chronic care management. They can do care navigation and clinical collaboration with other providers. We can provide participation in a health information exchange, behavioral health, or pharmacy support. These are the things that are really delivering a value relationship to your employees. People want to really understand the ROI and how these programs can help facilitate reducing costs. And you're like, David, that's crazy. You're going to increase access to care. Yes, that is fundamental. We want to give the inexpensive stuff away in the most effective way possible. We want to make it $0 to your employees, right? And when we do that, we see a significant reduction to your total healthcare cost spend, oftentimes up to 21%. We see huge reduction in claims. And because we're facilitating the relationship, right, employee engagement is really high.
Perfect. So David, at WA Group, one of our keys to success for our clients is really about executing the strategy that we have developed. Can you explain how ACOS helps us deliver our strategy and increases care and care navigation?
Sure, that makes a lot of sense. And interestingly enough, in the world that I live in, it's somewhat unique, right? There's two sides to the healthcare system. There's the demand side, and that is really delivered by consultants and advisors, right? And the demand is employers, employees. There's the supply side of healthcare, and that's providers, right? That's hospitals, that's drug manufacturers and pharmacies, et cetera, et cetera. So being able to closely align the demand and the supply side in the healthcare business is unbelievably cool. And Ron and his crew facilitate pulling those key stakeholders together in a very meaningful way. So the ACOS strategy, and really any strategy around reducing healthcare spend, is about removing the barriers to care. Okay, and if you look here on the left-hand side, those barriers are time, money, and transportation. Right? I suspect everybody on this call today, time is their biggest challenge. I can tell you, for me, time is my biggest challenge. I got 3 kids, they're young. I was traveling, I'm doing webinars, we're doing open enrollment meetings. You know when healthcare happens for me? At 8 o'clock at night, right? I'm able to facilitate that relationship. Dr. Sloan is my ACOS DPC doctor, and most of my healthcare is on our secure messaging platform, essentially emailing him back and forth at 8 o'clock at night. For a lot of Americans, probably for a lot of your employees, money is the biggest barrier. Look, a $50 copay, or if you're on one of those high deductible plans, a $280 office visit is a showstopper for most Americans. In fact, polls show that up to 40% of Americans report not receiving medical care, not seeking medical care due to cost, right? So if we can remove that barrier of money, that is a huge deal for most Americans. How about transportation? And this might be, do I have a car or not have a car? Could be. It also could be, man, the closest provider is 50 miles away. So if you're in one of those rural areas where choice is really limited, we can help remove that barrier of transportation or location. So when we do that, when we remove the barriers, when we work with a consultant and an employer to make this solution $0, right? We remove that barrier of money. We make it ridiculously easy and convenient. I don't know about you, but Amazon has become a lifesaver in the last 2 months. Um, but I'm the type of guy that likes to shop and be sold stuff and go to Best Buy and touch all the stuff. But Amazon has made it so easy to buy stuff. 10 o'clock at night, just hit the one touch button and away we go. It's coming the next day. So people value easy and convenient. How about the relationship? On these, and I wish we had a poll, but virtually hold up your cell phone if you have your barber on speed dial, right? Gosh, I need a haircut like it's no other, but I have my barber on speed dial, right? Okay, so put your hands down, put your phone down. How about ladies that are on the call? Do you have your nail technician? You get your nails done on speed dial? Most of the ladies are like, yeah, we got nails on speed dial. We get SMS nails. I have 2 teenage daughters. I know what SMS nails is. It's such a huge deal. But here's the thing, when I ask people in a group, right, raise your hand virtually or hold your cell phone up, do you have a doctor on speed dial? And they're like, no, they don't. And so we're really focused on developing that relationship so people feel comfortable that they can just call, text, email on our secure platform to get that relationship. And then we just want to make it anytime, anywhere. So what we've done is we have created the natural, easy entry point into the healthcare system. We're aligned with you and the purchaser and the user, you and your employees. And now we can help facilitate in a non-conflicted way, referring and navigating those folks through the healthcare system, right? So initially we're going to provide the care that they need, but 80% of the calls that we take, we facilitate getting the care that they need right then and there, virtually. And then when we need to access the healthcare system, imaging, labs, specialists, outpatient surgeries, et cetera, we can help facilitate that. And that middle pipe, right, is where the significant cost savings comes into play. Here's the reality. The cost of healthcare has not increased over the last 10 years. In fact, if you look at CMS reimbursements or Medicare reimbursements, which is kind of like the cost, it's increased about 1.4% in the last 10 years, 1.4%. Think about the increases that you've received on your healthcare plan. I can tell you it's way more than 1.4%. So you ask yourself, why is that? If healthcare costs hasn't increased, why has my insurance increased? Well, your insurance has increased, not the healthcare costs. So we have now been able to facilitate for you as part of that strategy, separating healthcare and health insurance, right? And when you do that, now we can facilitate the right care at the right time at the most appropriate location and the fair price and significantly bend the cost curve for your employer-sponsored healthcare plan.
Good. With that, we have another poll, timely. So we'd like to know from those out there, what would be your employees' top barriers to care? If is it cost? Many of us have HSA plans. Cost of care could be in the hundreds of dollars to see your primary care physician. Is it transportation, like David said? Is it are you in rural areas? Is transportation, getting to a facility, difficult? How about appointment availability? Or especially right now, when everyone is at home, how do we take time away to get to a facility when our kids are at home and are not at school? Or could it be fear of COVID-19 exposure? We have about 60% of you who have voted. I'll give it another 5 seconds or so. 3, 2, 1. Cost of care is preventing individuals from getting care. And so then the question is, if it's preventing individuals from getting care, and then now they need it when the care is more expensive, and the issue is bigger and the claim is higher, how does that impact your employee? How does that impact the group health plan? Interesting.
Great results on that poll. Interestingly enough, 50% reporting fear of COVID-19 exposure. Yeah, I mean, that's a sign of the times. It's interesting for me. I've been leveraging technology to receive healthcare. I'm a convenience guy, right? So a lot of the time my world revolves around what's the most convenient. So I've been using this strategy forever. And I've known for years, like the last place I want to take myself or my kids is an emergency room, even before COVID. Gosh, like flu, or I mean, there's just so much yucky stuff happening in an ER that you're exposed to. And now people have really realized, like, oh my gosh, I could get COVID if I'm exposed in urgent care or an emergency room. So I think that's pretty interesting, Ron, and very mindful, right, of the folks responding on this poll.
Go ahead, David.
So, interestingly enough, we talked a lot about kind of that doctoring that happens between episodes. And, Ron, that's around planned care. So this is the stuff that we find like, hey, your A1C is on the rise. Or, gosh, when was the last time you had a colonoscopy? I mean, you're not getting that when you go to the emergency room in urgent care. The doctor isn't saying when was the last time you had a mammogram or colonoscopy, or, we did some lab work to understand, and you're developing hypertension. So whole health evaluation, management of chronic disease, we call them the 10 percenters, right? And talk about strategy. Managing those 10 percenters within your group is so important, right? Folks with diabetes, high blood pressure, COPD, asthma, they create 80 to 90% of the costs in your healthcare plan and can lead to some other more serious, comorbidities, et cetera. Health coaching, coordination of referrals, and specialty care. This is the stuff that a relationship and a direct primary care solution brings to the table. Now, look, we all get sick, right? So 24/7 sick and urgent care is important. And I can tell you, again, I have 3 kids, man, those kids never get sick during the day and they never get sick during the week, right? It's always like 8:30 at night on a Saturday. Ron's 9 said, like, yeah, my kids do the same thing. 8:30 at night on a Saturday, that's when they get sick. So in our solution, you have 24/7 access to a provider, right? But the difference is if your provider's on call, you're going to see that provider, right? You're going to have continuity of care. If your provider's not on call, you're going to see one of the partner physicians in the virtual practice who's going to have the same access to your medical records, the same access to all of your chronic disease, management solutions, et cetera. And we can diagnose, we can create a care plan, we can prescribe when appropriate, we can do follow-ups and referrals. And we haven't necessarily left the reservation, if you will, right? It's all contained and everybody is communicating. So we know how to facilitate the next steps, right? And that's really important. Care navigation. That interesting that poll said, renewals and healthcare costs and this and that. The easiest way to facilitate reducing your healthcare costs is to engage with an organization that is providing easy care navigation to their employees, right? Look, I'm a healthcare expert in buying and procuring healthcare services, but I can tell you, when it comes to me and my family, I become the dumbest guy in the room, right? So when we're care navigating folks through the healthcare system, we work very closely with Ron and his team to understand your plan parameters, to set up a plan design that makes sense, to understand the network or reference-based pricing or direct contracts that have been put into play, specific programs like musculoskeletal, pharmacy programs, and then help your employees go to those high quality providers, receive the right care at the right time at the most appropriate location, right? If you think you broke your toe, the right time might be in the morning at an freestanding imaging center when our provider writes the orders for an x-ray and it's $50, right? If your toe is dangling by a thread and you're gushing blood everywhere, the right time is now, the right time or the right location is an emergency room, right? And the right price is whatever it costs to facilitate taking care of that toe. So these are the things that we're able to facilitate consistently. And here's the thing, I've been in lots of industries over my career. There is an inverse relationship between quality and price in the healthcare industry. It's crazy. So just because the place has a piano in the lobby, right, and private room and has gourmet food, doesn't necessarily mean your employees are going to get the right care at the right time at the most appropriate location, right, and at the fair price. So being able to have a team dedicated to your employees and fundamentally spending your healthcare dollars. Let's call it the way that it is. Those are your healthcare dollars that we're spending. We want to spend those in the most mindful and meaningful way so you get the most ROI on those dollars possible. We're also able to coordinate some additional services. Some of the strategies that put into play, especially around self-funding and those opportunities we're in that structure, is access to direct contracted services. These are a fraction of the cost and ultimately provide value not only to your employees, but again, bend that cost curve with bundles and whatnot for those contracted services. Mental health, so important. We can coordinate that. Addiction medicine, lots of employees are dealing with folks that are addicted to opioids and whatnot that's ruining people's lives and costing billions of dollars in employee healthcare benefits. Sleep apnea, that's another program that we can coordinate and your employees have access to on this particular platform. Look, creating the relationship and onboarding your employees is critical to the success of the program. We work with Ron, and Ron works with you and your HR team to facilitate a united opportunity to deliver and increase access to care and control costs, right? So when we receive eligibility, right, and we know who your folks are, we're going to send them an email, we're going to send them a text message, we're going to invite them to complete their ACOS account, right? And it's really cool technology, super easy to engage and facilitate. It's device agnostic. Every employee is going to have the opportunity to complete a health risk assessment. And this is going to give us a little data on every employee that is secure, that's secure, et cetera. We're not going to share it with you all, the employer, but we're going to able to kind of carve out those 10%ers. We're going to be able to address some of the chronic disease within your group. And we're going to do that with a phone call from a care navigator. So everyone's getting a welcome call from a care navigator, inviting them and welcoming them to the ACOS product and solution and all the benefits that they receive. We're also going to be able to facilitate a first appointment with their very own concierge doctor. Again, a game changer. A lot of folks, I'm sure within your employee group, they've never had healthcare like this before. And that doctor might just have an introduction. And if you're healthy as an ox, hey, we'll talk to you in 3 months. That's great. If you have some concerns, if we've noticed some things in the health risk assessment that we need to address or any gaps of care, we're able to facilitate that. Again, the goal here and the strategy is to deliver to your employees an easy, free, and relationship-based entry point to the healthcare system, right? And then we're able to make sure that they get the highest quality care at the fair price every time, and that's what we're focused on.
That hand holding is unique. That's cool to see. But it probably also comes with some robust technology that comes along with it. Can you dive into the technology piece and educate us on what that looks like from an ACOS perspective?
Yeah, I've been in this space for quite some time, and scaling these types of solutions and really being able to facilitate and execute them, again, is what we're able to do and what we're signing up for, right? We're here to execute and help you drive the strategy through your healthcare plan. We do have kind of a back end, if you will, called our Comprehensive Care Management Portal. And this is really cool because not only do our providers use this technology to guide people through the healthcare system, we're tracking and facilitating referrals This information is also available through the member portal. So now you're able to have your health records and everything about your health in one easy to access location in the palm of your hand, right? Which is really, really, really cool. It gets everybody on the same page. We're a very collaborative group, so we want to be able to facilitate conversations and data exchanges with the neurologist, with the cardiologist, with the imaging center, with your pharmacist, right? So these people all are interacting together in a holistic way, and we're just removing the silos that exist in the healthcare industry today, right? And when you remove those silos and everybody's on the same page, the care goes up dramatically and the cost goes down. We're not ordering duplicate procedures, right? We're leveraging the x-ray that has already been done, right? Not doing 5 more. We're doing those things in a very collaborative way. And the technology that we use gives us the ability to facilitate that for every employee. There's a little bit more on the care collaboration. Again, we load in all the providers that your folks are seeing into one comprehensive database, and then we can have an information exchange on what the neurologist is up to, what the cardiologist or that is managing, a nephrologist, whatever those providers might be. It's a very collaborative and open dialogue to make sure that the patient is getting the appropriate care, but there's not a bunch of duplication of services. Perfect. Yeah. So this is what the employee-facing care management module looks like. There's a patient summary page. We load in all of the benefits that are associated with your plan into there. They can schedule appointments online. We do some connectivity to your PBM or pharmacy benefit manager, so they can access low-cost drugs. We have the ability to share these medical records. So when your members go in or your employees go in and they're seeing a new referral that we've sent them to, they can share their medical records. So they're not starting over from scratch, right? And we're extending that continuity of care, that concept of continuity of care to other providers. And that we provide real-time communications. Like I said, for me, it's our secure messaging app at 8 o'clock at night. For some folks, they want to connect via phone, right? Just pick up your cell phone. For a lot of people, they think video is the way to go. So we give them the ability to connect with a primary care physician in the way they want to connect, which is really important, again, in removing those barriers to care.
So helping employers really take control of their health plan is kind of what we're all about. And so with this being one strategy to be able to do that, will you show what employers will see when it comes to, is this working? Is it not? Is my return, do I have a return on my investment? Walk us through some of the ways that you're able to show employers that information.
Absolutely. Data is king, right? And there's a lot of platforms out there that provide historical claims data. That's awesome. That's really cool. It's super important. And we can utilize that as a strategy to help reduce costs if we know where the high cost claims are, or where those dollars are being spent. Our system focuses on real-time reporting. Remember, what we're facilitating is connectivity to the healthcare system in real time, including our own providers and the virtual office visits that they're receiving, and then others. So in our analytics and reporting platform for the employer, we can give you some input and show you heat maps around any sort of condition, whether that be diabetes within your organization, hypertension, joint pain, opioid abuse. These are all things that we're able to report on. We're also able to report on the utilization of these services through your TPA, et cetera, et cetera. But here's the big idea and the most important concept. Data is cool. Love data. It can tell you a lot about your plan, how it's running, et cetera, et cetera. But being actionable is the most important thing. And here's the thing. No one wants to hear from me. No one probably wants to hear from Ron or his team, an insurance company, a TPA, the employer, et cetera, et cetera. You know who your employees want to hear from? You know where they're going to change the behavior or change the opportunity or seek care? It's from the doctor, right? So now you have an aligned provider and team that's able to take action on these reporting and analytics, and we can do so because we're the provider, right? And that is super important. Look, there's lots of solutions out there in the marketplace today that can potentially increase access to care, potentially reduce costs. People have been, pushing in the telemedicine world for a while. Up until 60 days ago, that was a 3-4% utilization, 5% within a group. Pretty limited in focus. So what we bring to the table and our strategy brings far more services and a very comprehensive approach to virtual medicine. Brick and mortar DPC, that is a fantastic strategy, right? And there's lots of direct primary care doctors in local markets all around the country that are doing some unbelievable work, okay? The problem with tying yourself to, excuse me, a brick and mortar strategy is you're stuck with those locations. And it's hard to scale. So when you remove that brick and mortar limitation, now we can deliver a DPC strategy to everybody within your employer group. Look, the last piece is onsite. It's super vogue right now, right? If you're looking at the Fortune 5 companies, Amazon and Nike and Apple, they're all doing two things, right? Amazon Care, it's a virtual clinic, right? Amazon Care is a virtual clinic, just like ACOS. They're also providing on-site solutions at their facilities. On-site is great, but it can be very expensive. So our solution, actually, we can deliver multiple strategies to employer group and deliver Amazon Care, right, to a group of 50 lives. And that is the huge opportunity, versus some of the other solutions in the marketplace today.
Great. Thank you, David. With that, we have our last poll, and this could backfire on us, but would you be interested, those employers that are on this webinar now, knowing what you know, would it be of value to you and your organization to be able to provide care to your employees 24 hours a day, 7 days a week, at no cost to the employee? Can't imagine we would have any no's on this, but you never know. So 40% in or so, 100%, give it 5 more seconds, 4, 3, 2, 1. It makes sense. So thank you, David, for your time and your expertise. To circle back with the housekeeping, if you have any questions, we're collecting them, we're compiling them. We will put together a FAQ, we'll add it to our website, we'll add this video to our website as well. I will also send out the FAQ in email format. Again, if you would rather connect with one of our team members, you can do so here. I'll leave this up. A reminder that our upcoming webinar is in 2 weeks. It's regarding cybersecurity risks in today's work from home environment. Obviously fitting with what's going on in today's world. And with that, we appreciate everyone's time. Thank you for joining us, and we hope you have a great day.